All right, everybody, we are going to go ahead and keep on rolling here. I'm really excited to introduce our next speaker from Shackelford Strategies. I'm talking about marketing with a conscience. Please welcome to the stage Melissa Fors Shackelford.
Well, good morning, everybody. I'd love to ask you all to start by thinking about a patient. And this could be somebody you treated, this could be someone in one of your research studies, it could be a loved one, or it could be yourself. But I want you to think about a patient that's scared, that's nervous about what's happening, nervous if they get paid for the procedure, nervous because they don't know where to go, and they're just filled with fear. So think about that patient, and that's the patient I want us all to think about during this conversation. And the real question is, are we worthy of that patient's trust? And I'd like to start with my why. Why do I care about marketing with a conscience? And why is this a topic I've been digging into for 15 years? Well, for 10 years, I worked at a healthcare provider. And it was a certain segment of healthcare, and it had so much unethical, fraudulent behavior in their marketing and their communications to their patients. They had such high pressure tactics for patient acquisition that eventually Google banned them from advertising. So Google's the largest advertising platform in the world, and they've said, we're gonna forego hundreds of millions of dollars of advertising dollars to protect vulnerable families from these fraudulent, deceptive, misleading, and high pressure tactics. So we'll talk a little bit more about that later in the presentation. But that's really when I got started digging into how can we be the gold standard? How can we raise the ethical bar and do all of our communications with our patients with the utmost integrity? So the question today is, if healthcare is built on trust, why does some of our marketing erode that? And I gave you one example. We'll go through a couple more today. Here's where we'll go through our time together today. We're going to start with drift. And what I mean by drift is we have an ethical center, and how do we drift from that? And that's really what we'll dig into today. We'll talk through two examples of situations where the organizations or the industries really drifted from their ethical center. We'll talk about stigma and language and how that's important. We've heard a lot, actually, and I'm so happy about it. We've heard a lot the last couple of days about stigma in different areas. We heard about the stigma of going to an FQHC yesterday. We heard about stigma for chronic conditions. We heard about stigma around people with disabilities. There's so much stigma in healthcare, and that's an area of sort of ethical and integrity, and having integrity in your marketing that we don't often talk enough about. So I was thrilled to hear it yesterday. Then we'll talk about a framework I use for making sure we have that ethical communication with our patients and in patient communications. And lastly, because every single presentation at this event has to talk about AI, I will talk a little bit about AI. Honestly, AI and patient communications could be a whole nother topic, but we'll touch on that today because that just raises the level of urgency of how we deal with our patients. And I'd like to start by saying that most people, when they're focusing on patient acquisition or communicating with their patients, they don't have bad intentions. I honestly feel like people are attracted to healthcare because they want to help. And someone like me who's not a clinician, I was attracted to healthcare because of that fact. Because I may not work with patients every day, but I know I can impact their lives. What we have, though, in healthcare is a system that makes it really easy to drift. And these last, I'm gonna say 6 years, have made it so evident. So we've dealt with a global pandemic that threw everything on its side. And healthcare today is under such pressure. We've got issues with Medicaid, Medicare. Yesterday we heard about research grant dollars, all these different areas that are sort of in trouble in healthcare. And we know our margins are shrinking. And so there's always pressure to get more patients, do more procedures, fill those beds. And with that pressure, that's when even people with the best intentions start to drift into areas they might not have otherwise. So I'd like to ask all of you a question. And this is about yourself or maybe a loved one. But raise your hand if you have ever searched online for information about a health diagnosis, information about your health insurance, information about which providers are covered for you, and you've come away, or your loved one has come away even more confused than you started. Anybody? Okay, just about everybody. So imagine you are that patient who is so frightened, fearful, and vulnerable. And they're going online and they're searching, and they're coming away even more confused. That's why it's such a problem. And that's why people delay care. That's why they're frightened of the healthcare system. Oftentimes they are searching for information at the most vulnerable moment of their lives. And we talked yesterday, we heard quite a bit about health equity too, and health literacy. So someone can have a very high level of health literacy, but when they're worried about their child's health, or they're worried about their elderly parents' health, or themselves, that health literacy kind of goes out the window because they're of that fear that they have. And we have to remember that a lot of our patients are just so vulnerable because of that fear. We talk a lot in healthcare about, do no harm, and we think about that in the clinical sense. But I'd like to propose that we actually think about that also in a marketing sense. Because marketing is the first touch to your patients. They're gonna see your website, they're gonna get your communications, they're gonna get your postcard in the mail from your health system. It's often the first touch to those patients. And we have things like patients being very confused. They don't understand, they're searching, they can't find the right information. A really dangerous one is offering false hope. And this is where we have these wild claims that this will happen or you'll be cured from this. But there's all this sort of fine print at the bottom that says, well, only for these types of people, only with these conditions, blah, blah, blah. And that's not being ethically clear. And we need to think about that again, because these are patients with the most valuable thing that they have, which is their health care. We also have to worry about exclusion, and we heard great talk yesterday afternoon about focusing on the media and how we represent people with chronic conditions and disabilities. We also have to remember that a lot of people feel excluded by the health system. And this is oftentimes because they don't see themselves represented on your website, in your communications, or they don't see themselves represented in your staff. And that's another reason why they don't feel comfortable, they don't think that they're welcome at this institution, so they delay care or forego care. And that's something that we can make an impact on. So talked a little bit about all of the pressure in healthcare, and I think everybody feels it because There's just, like I said, there's so many things happening right now, and you don't know what's coming next. You know, I've talked to so many people who've had their grants pulled and then they come back, and, or someone is focusing on Medicare or Medicaid, and all of a sudden you don't have the dollars that you used to. So that's kind of how people start to justify some of these questionable tactics. Well, it's not technically illegal. Well, actually, there are some things that are illegal that are overseen by the FTC. You cannot do deceptive and misleading advertising. That is actually illegal, and the FTC will enforce that. I actually have one example to talk to you about. So there's some things that are illegal, but the most of it, when we're just talking about that ethical drift, it's not technically illegal, or everyone else is doing it. Our competitor down the street, they're doing this, so why don't we? And then we just need to hit our numbers, and that's something that I think a lot of us hear on a regular basis. It's the end of the year, it's the end of the quarter, there's this pressure that we have to do these things. And that's how, when you start with really good intentions, you start to see that drift. And oftentimes that drift starts really small. Small editorial choices. Sometimes it's the outcomes that you lead with and the other ones that you bury. Or you put it into the fine print at the bottom of the page that nobody can find. Or it's in a section on your website that, again, is hard to find. And when we talk about urgency and pressure, how many of you have, outside of healthcare, how many of you have had an experience where you felt pressured to make a decision to buy something, either by a super aggressive salesperson or by an ad that was pressuring you? Does anybody have that experience? I know I tried to buy a washer and dryer, and every single place we went to, they said it was the last one available. Because they were just pressuring us. But imagine if I'm considering and worried about my health care, and someone's pressuring me to buy today. It seems absurd, but it happens all the time. And there shouldn't be any of that high pressure sales in healthcare, but there definitely is, especially in institutions that are struggling. And lastly, just another editorial choice about being welcoming. That's again about how do we show our imagery, which staff are we highlighting, and do we look like the community we're serving? Because if we don't, oftentimes people, they just don't feel welcome to come to your care. Here's my first example I wanted to get to. And this is the industry I mentioned at the beginning that was banned by Google. And I've heard substance use disorder mentioned a couple of times yesterday. Oftentimes we shove it to the side of what we consider traditional healthcare. Mental health and substance use is off to the side, but I think we all know, especially in these last few years, we've got the opioid epidemic, we've got all these things it's trickling through all of healthcare. I worked at an organization that was considered the gold standard for care in substance use disorder. And so we felt that our marketing had to raise the ethical bar. But there was so much deceptive advertising, people impersonating other providers, high pressure sales tactics, as well as lots of false claims. That's when Google stepped in and banned this entire industry from advertising for almost 2 years, in 2018. And now for this industry to advertise on Google, they have to go through a number of different kind of procedures and be certified to make sure that they have integrity, that they're who they say they are, and that they're not doing any of these fraudulent things. You also see that with online pharmacies. You also see that with bail bonds and weapons and things. And the sad thing is that substance use disorder is an important part of healthcare, and the fact that it was being treated like this and banned tells you how bad it was. And we do know that this is oftentimes the most vulnerable day in a patient's life or a family's life. I mentioned at the very beginning, think about a patient who's afraid. Well, imagine if you're the mother whose child just overdosed and you're in a panic. What do? Or you're a husband whose wife just had her second DUI with the kids in the car. Or that your mother fell down the stairs because she was drinking too much. There's so much shame around this that people, they don't necessarily go to the same channels they would when they have a broken arm or their child needs braces. And so they're so vulnerable at that moment. They're in a crisis. They don't know where to turn. And that's where a lot of these people were preying on them. And that's again where Google, of all people in the world, had to step in. And there's still a lot of these practices. These people, they're not comparison shopping. They're not calling their local hospital. Most of the time, they're not reaching out to their primary care because, again, there's so much stigma and shame around it. So they're likely not going to get the best care available. And oftentimes they're being talked into care that's self-paid, and it's very, very expensive when their insurance might have covered someplace else. Here's an example. This is a real example. I took out the company's name, but this was actually last year. The FTC had to step in with a substance use disorder treatment provider. So they were in Florida, and no offense to anybody from Florida, but there's a lot of healthcare fraud that happens in Florida. What they were doing was impersonating other facilities. So they were placing ads as if they were another facility. They were answering the phone as if they were another facility, and they were getting those patients in the door. And this might not have been the appropriate place for that family to go to. But again, I'm a family, I'm in a crisis, I'm in a very, very vulnerable moment. And who do I turn to? Well, here FTC said they had 68,000 fraudulent ads and 3,500 people were impacted. So they had to pay a $1.9 million fine, which actually sounds kind of a lot, but maybe not a lot. But the FTC had to step in. And these are families that, again, they're really vulnerable. We want to be cautious about how we deal with them, and we need to raise the ethical bar. Some of the other examples you see in substance use disorder marketing are over-promising what the results are. You see 98% cure rate when we know it's a chronic condition. There's so much urgency. We only have one bed available. You need to decide today. And this is just it still happens to an extent, but it's gotten much better after Google banned the industry. In any other industry besides healthcare, misleading advertising, deceptive claims, high pressure sales, you end up maybe with an unhappy customer that's going to return their product. But in healthcare, we're talking about someone's own health. We're talking about their loved one's health. And if we're pushing them to delay care, get care that they don't really need or they don't really want, or go to the wrong place or have to self-pay, we need to remember that healthcare is a whole different ballgame, because they can't just return the product or give you a 1-star review online. The way I look at it, as the more vulnerable the patient, the higher the ethical bar. So it's disproportionate. We need to remember that a lot of our patients and their families are so vulnerable, so we need to raise the bar even higher than we would if we weren't dealing with these audiences. And I've heard them spoken about yesterday quite a bit. I mentioned FQHCs. During that session, we talked about a lot of immigrant families that have English as a second language. And again, it's very easy to not understand What's the best path? Yesterday, we had a presentation about people that were deaf and hard of hearing. Again, a very vulnerable population. Now you add on top of that, we're talking about their healthcare or the healthcare of their loved ones. And we really need to raise the ethical bar and treat these people with much more integrity in our communications, much more empathy. And empathy, I think everyone here, I've heard empathy throughout all of the presentations. Everyone in healthcare usually is filled with empathy for our patients. And empathy in marketing really means putting that patient at the center and caring about them like you would care about your loved ones. It's asking what it's like to be that person. So that's where at the beginning, I asked you to think about a patient who's scared and worried and nervous about what's going to happen next. And that could easily be you or your loved one. I mean, I've seen it. I've had lots of my family members in the last couple of years have a disproportionate amount of healthcare needs, and there's been a lot of fear and a lot of anxiety. Now I'd like to ask you another question, a little more personal this time. But have any of you ever hesitated to tell your provider something, or just not said it at all because you're worried about their reaction? Anybody? Anybody? A few people, looks like. I think about people who are smokers, people who have struggles in other areas, people who are drinking too much, people who maybe are following the recommended diet, people who aren't taking their medication as prescribed, all sorts of different things that people feel such shame. And that's something that we can work on and we can improve through our communications. Because again, the communications from your website, from your email, from your mailers, the signage in your buildings, that's the first touch to these patients. And if they feel stigmatized, if they feel shame, or they're worried about that, they're going to not tell you. They're going to hesitate to tell you. They're going to not come back, or they're going to delay care altogether. I was so happy yesterday that we heard stigma in so many presentations, because this is something we can actually do something about. And I say we, not just someone who deals with communications and patient acquisition. This is something that anyone who works in healthcare can help break down these stigmas. And one of the ways we can do that is through patient-centered language. And this one, I'll use obesity as our example. If we call someone, oh, they're an obese person, we're shaming them, we're defining them by their body. If we use person-centered language and they're a person living with obesity, it separates them from their condition. We can do that with all sorts of other conditions. Rather than saying someone is a schizophrenic, it's someone living with schizophrenia. We do that well with cancer. We don't say someone is cancer, it's someone living with cancer or someone. So we can, this is a really easy way to remove stigma and remove that judgment and shame on that person because they have a healthcare condition. They are not their healthcare condition. Great example is substance use disorder. I've heard this also yesterday. Calling someone an alcoholic, calling someone an addict is one thing. Saying it's someone living with a substance use disorder removes so much of that judgment and shame. This is another one. I've actually used this example for many, many years. I've done a lot of work with the American Lung Association. They do so much to try to break down the stigma of lung cancer. And we still hear, and I feel like this is one of the most stigmatized conditions people can have. We still have people say it's smoking-related lung cancer, or it's not smoking-related lung cancer. And that's not acknowledging that nicotine is a very addictive substance. It's very difficult to quit. And And so these are people that are living with a condition and they feel the shame all around them. And I'll actually give you here just a personal example with this one. My younger sister wouldn't have identified as a smoker, but she smoked. But she said she only smoked when she was stressed out. So she didn't say, I am a smoker. And she felt that shame and judgment, so she didn't tell her doctor that, because I'm not a smoker. And so she was never offered early detection lung cancer screenings. And so about a year and a half ago, she was diagnosed with lung cancer. And the problem with that is you need to, when you're diagnosed with lung cancer, you should be focusing on healing. And instead there was all this judgment and shame because she knew she was a smoker. And so this one I feel really strongly about. How can we remove that judgment and shame and say it's just a person diagnosed with lung cancer? This is another one, it's another word we can retire, victim. When we say AIDS victim, it's putting so much shame on that person and on the whole disease. When today we know it's a chronic condition and it's a person living with HIV, and we can use this for so many other conditions. But the word victim, again, is another reason why people won't come in to get care, because they're feeling judged. And we want to make sure that they're empowered, that they feel welcome to come and get care. I'm not going to spend a lot of time here. I mentioned before, one of the other things that's not hard to do is to make sure we have inclusive imagery in everything we do, and the providers that we're highlighting represent and reflect our communities. So oftentimes communities don't feel welcome and are hesitating to get care because of that. They say, well, they don't care about people like me. And it could be yesterday we heard about deaf and hard of hearing. It could be yesterday we heard about an FQHC. All the different reasons why people might not feel welcome, and really making sure we keep it top of mind to make sure we're reflecting our community. Sometimes when I talk about these topics, people say, well, yeah, this is all fine and good, it's just kind of your opinion. But just about every medical association in their code of ethics talks about advertising, marketing, and communications. So here's the American Medical Association saying aggressive high-pressure advertising should be avoided if it creates unjustified medical expectations. So telling them we've got a 100% cure rate is an unjustified medical expectation. Using terms like world-class, top, and pioneer are designed to attract vulnerable patients. And again, making sure that any claims are factual, that they're double-checked, that you have those sources that you can cite is so important. So these are some of the medical associations that all, if you check with their code of ethics, they all say these things. Here's a couple more to be cautious of. One I really love is the orthopedic surgeons. So the orthopedic surgeons should be cognizant of how their services are being advertised by their employer or affiliates and ensure those statements are not false or misleading. Because oftentimes those are. And we have to be, again, cautious and aware, because these are the first touches to our patients. And I love this because these are not marketing consultants. This is the actual medical community saying all these things. So I've talked about a lot of the bad stuff. So let's talk about what ethical marketing actually looks like. And in my work, I like to use 3 anchors sort of as a framework for communicating with patients. And these are things that if you're a physician, you can think about that frightened patient, or that patient who might not come back, or the patient that never came in. If you're a researcher, you can think about how are your findings being communicated out in the world? And if you're a founder, if you're building something, think about those patients that you're building to serve, but will never be able to use your product or service because they're too afraid of the healthcare system. So my first anchor is clarity over cleverness. And clarity is always the best guiding light for everything with patient communications. We use all kinds of jargon in healthcare. And again, someone can have the best health literacy in the world. They can work in the healthcare system, but when they're frightened because of a diagnosis for their child, when they're worried about their husband or wife, all of that goes out the window. We need to be as clear as possible with those folks. If they can't understand it, it's not ethical. Something can be technically true, but not ethically clear to these individuals. And I don't mean dumbing it down, I mean making sure it's something that they can understand. Because when people are confused, like I asked at the beginning, has anyone ever been confused, whether it's about how much something's gonna cost, who's in network, or which doctor is the best doctor for this procedure, or which exam you want to get, or you think you might need. People are confused, and there's a lot of, in the last talk I heard, questions about misinformation. There's a lot of misinformation. We need to be the high ethical standard in this process. Here's another example around elective procedures. And I use this as an example because for a lot of health systems, this is a high growth, high margin area, and they're pushing elective procedures. They could be targeting somebody with chronic pain that maybe they actually don't need that knee replacement, but they're pressuring them to get it because, hey, we need to hit our numbers. We need to push elective procedures. And this one's from orthopedic marketing, but I love it. These are things that are considered misleading when we're talking about some of these elective procedures. Again, using terms like top surgeon, best doctor, the pioneer, revolutionary technology. Well, if it's not clear to the patient or their loved one, they're not able to make an informed decision. And that's what we need to be going for, especially with elective procedures. Are they making an informed decision, or are we pushing them to do something that they're unsure about? Using the term safe, and again, safety is always qualified in healthcare. So are we providing information to let them make an informed decision, or are we doing mildly high pressure sales tactics? The tension here with elective procedures is that, yeah, these help people. My husband had terrible knee pain. He got a knee replacement. Wonderful. It was a wonderful thing. But he also was allowed to wait until he was ready and until we could make the right decision for our health insurance, so we knew what we were going to pay. We knew what the expectations for outcomes were. We knew which doctor we wanted to go to. We felt that we made a very informed decision. We were not pressured into doing this now. And so really, because these are good, these help people, where's the line? And I think it's really asking this question. Are we guiding them towards the decision, an informed decision, or are we doing something that would benefit us? And that's a question we just have to ask ourselves. The next anchor in this framework is be a voice for the vulnerable. And I've talked quite a bit about vulnerable patients. We've heard that yesterday as well. There's so many of our patients are very vulnerable at this moment in time. So how do we be a voice for them? And how do we keep in mind with everything we do for patient acquisition and patient communications, thinking about the most vulnerable patient, that worried mother, someone deaf or hard of hearing, someone who has English as a second language, they're worried, someone just had a heart attack, someone just had an overdose. They're extremely vulnerable. They're not thinking the way they would if they were purchasing a new car. If we build that question into everything we do, we're raising that ethical bar. Vulnerability isn't always super obvious. It is, I think, with substance use disorder. These are families in crisis, and they don't know where to turn. With elective care, are they really vulnerable? Well, they're easily susceptible to our nudges. If we really want them to, hey, we've got space available next week, you should do your knee replacement next week. Or are we providing them information so that they can make an informed decision? They are also a very vulnerable audience because they're so susceptible to those kinds of pushes. The last anchor in the framework is using purpose as a filter. And I started by saying most people come to healthcare because they want to do good, they want to help other people. So if you're doing some sort of advertising campaign to get more patients in the door, which every health system is working on right now, they're all trying to get more patients in the door. Are we using purpose as a filter? And I define purpose as really your mission or what is your North Star. Because there's some campaigns that might really perform well, but maybe you shouldn't have even done it in the first place. Questions to ask before anything goes out the door is, does this build trust or does it erode trust? Because trust really is the currency of healthcare. Trust is what everything is built on, and if people don't trust us, they're not coming into care. Who could be harmed by this? And is it fully true or just technically true? Is it technically true or is it ethically clear to them? A couple more questions. Does it reach the people who most need this care or just the people we normally talk to? And am I telling a story about this community or for it? We heard a great example of this yesterday with the talk about FQHCs, if any of you were in that session. Not doing the work without the community as participants. Something can be technically true, but not ethically clear. So something's technically true, we might be guiding them to a decision and giving them information that they can't verify. And if something is ethically clear, we're helping them make an informed decision. So some examples are 98% improvement in substance use disorder. Okay, can this prospective patient verify that? Maybe, maybe not. What is more ethically clear is recovery rates vary. This is a chronic condition. Here's what our outcomes actually say. Saying something's a #1 rated program, this is a pioneering surgeon. Again, this is something that the prospective patient can verify. This is helping them make an informed decision. Or let's show you how we're measured and what this means for you. Life-changing results. If you look at hospital advertising, everyone says life-changing results are world-class. But again, what do those actually mean? If we're really clear, it's this procedure helps these types of people so they can really make an informed decision. Or the call now, don't wait, we've got space available for your knee replacement next week. And so you feel like you're pressured into a sale or a purchase or getting that procedure. Instead of informing them and giving them the tools to make the right decision and giving them the time to make it on their timeline. So I gave you a lot of bad examples, but I want to give one good one. And this is one that I like because it's putting accurate information out into the universe And we all know there's so much misinformation. The last session just talked about misinformation from AI images. There's so much out there happening. This is an example of the Cleveland Clinic. And the Cleveland Clinic, about 10 years ago, they scrapped all of their blog and they said, we're going to start a whole new blog. We're going to be the go-to source for accurate health information online. Kind of be the new WebMD. So that's what they did. They only put information on their blog that patients want to find. It's nothing about, well, the cardiac department wants to put this out there. It's none of that. It's all information that patients are looking for. And everything has been validated by an expert. The other thing they do is, this is not an advertising platform. They are not advertising. We've got this, new wing we just built to do this or that. We have this new device or technology. It's not about advertising. It's purely about informing patients, and not just their patients, it's for patients across the world. Oftentimes, if you're searching, or your loved one is searching online for information, a lot of times you end up with the Cleveland Clinic. They also are very public about their ad policy, saying what they do and don't do, and their blog, again, it's not for advertising. Of course, it's bringing people to their website, but it's not for advertising. And by even doing that, they still get 12 million visitors a month to this website. So they're ethically clear and they're validating everything. And they're not doing high pressure sales, they're just providing information. Now, because every presentation at this event has to talk about AI, now let's talk about AI. And AI with patient communications, I think, levels up the sense of urgency for us to focus on ethical marketing and building trust with our patients and prospective patients. So this could be a whole talk on itself, so I'm just going to really touch on it. But there's been some amazing research already done in this space about communications about AI. And we know that so many individuals today do not believe that their health system has their best interests at heart with the use of AI. They are worried about it. But there was actually some research done, I think it was last year, by a team actually at my alma mater, the University of Minnesota, that was published. And that told us that if there's already a trusting relationship with that doctor or with that health system, people are more okay with the use of AI. So the trust relationship with the patient has to precede introducing AI. And yesterday we heard about the use of AI scribes. And I think about myself and I think about my doctor, and I'd be fine if she's doing an AI scribe. But I know her, I trust her, I'm not worried she's going to not have my best interests at heart. So that's what the research is telling us. The research is telling us people are still skeptical that the healthcare system is going to use AI with their best interests at heart. And when I think about my framework, it definitely works for communicating about AI. Clarity over cleverness. We need to be very clear about what is our use of AI, how we're going to use their data, how we're going to keep it safe and private. Being a voice for the vulnerable. There's a lot of people who don't understand AI. They're fearful of it. We need to make sure that they have a very clear understanding of what we're going to do. And lastly, keeping purpose as a filter. Making sure, and this came up again yesterday in one of the talks, actually several of the talks, are we using AI and all this innovation to benefit us? Or are we benefiting those patients? We need to make sure that we're focusing on that trusting relationship with our patients before we are introducing all of this AI. Sometimes I hear people say, well, yeah, this is all fine and good, but again, my health system is under such pressure. We need to do whatever it takes to get patients in the door. Again, that's where that sort of ethical drift happens, is under pressure. But in reality, when we're building those trusting relationships with our patients, they come back. They're willing to come and get care. They're not delaying care because they feel judged, or they feel manipulated, or they are unsure of what's going to happen. When we build trust with the community is going to continue to refer patients to us, and they're going to embrace us and keep coming to us. When a referring physician trusts us, they're going to refer patients over and over again. So building that trusting relationship through ethical communication, it really compounds over time. And so this is something that I think is really easy to push back on when there's pressure about financials and healthcare. By doing the right thing, it actually works and it performs better. One of the things we all have to remember is that the first moment of care is oftentimes the marketing message. So it starts way before, a lot of times we think that digital front door is the first moment of care, or the receptionist at the office is the first moment of care. It goes, these days, it's on their phone. And on their phone, or on their computer, on their iPad, they're being touched by your messages, and that's the first moment of care. So this is not really, in healthcare, it's not about being a marketing campaign, it's about being that moment of care and that first touch. The first time a patient encounters your organization, how do you want that to be represented? These patients, they're trusting us to guide them to informed decisions, not persuade them and sell them something about healthcare. Again, these are patients who are a mother searching for help at 2 o'clock in the morning. She can't sleep, she's so worried about her child. Somebody who's anxious about their condition, and they're using Dr. Google or Dr. ChatGPT and freaking out. These are the people that are bringing us their trust, or we want them to bring us their trust. So if you look back, think back to that patient you thought of at the very, very beginning, that person who's afraid, nervous, uncertain about what to happen. The real question is, I said at the beginning, are we worthy of their trust? And that's the question I really want all of us to keep in mind. Does your marketing deserve the healthcare, the trust that healthcare depends upon? Thank you all for listening. I appreciate it. I can't wait for the rest of the sessions.
Sure. Okay, thank you so much for that. Do we have any questions from the audience?
Hi, thank you so much. That was really interesting and insightful. You alluded to the external pressures on healthcare institutions that in some ways are driving this. And I know they're coming from a lot of directions. I wonder if you had any experience or thoughts specifically on private equity, where one of the defining features is the goal is to really increase revenues and reduce expenses fast in order to sell off the hospital.
Yeah, that is absolutely one of the use cases that makes so much more pressure on an entire team, an entire organization, because they have to hit their numbers because the PE organization is saying this is what you need to get to. That's where you see a lot of that ethical drift in situations like that. So yes, I've had experience in that, but it's really hard to push back on those PE teams. So for me, a lot of it is to say, let's look at the long game here. When we build these trusting relationships, we're going to get those referrals over and over. Someone's going to refer their friends, the community's going to refer people, those third-party physicians are going to refer patients. We need to look at that kind of an ecosystem versus saying, you need to do these high-pressure sales ads, and your call center needs to convert people to patients. And the PE situation is a perfect example of the high pressure.
Any questions?
Thank you for such an excellent talk. You walked us through the role of building trust through marketing materials and teams to expertise. I wonder if you have any thoughts or reflections on the role of social media and the growing role of influencers in promoting health claims, many times without any backing. And there are also influencers claiming to counteract this trend of trying to say that they are the credible voice and trying to dismantle abuse by others. What do you think about this growing system and several times? Thank you.
Yeah, that's a great question about so many influencers are where people are getting their healthcare information from today. And a lot of that is misinformation. So that's a great point. The way to combat that misinformation is to continually put out something that is ethically clear and technically true and cite those sources and using your experts. That's the other thing I like to do. Make sure you're having all the information, citing the source and using your experts and having those experts talk about their credentials. That's a way to combat some momfluencer who's telling people to do this or do that, because that is absolutely where people are getting a lot of this misinformation. And that's where they're also getting ideas like, I need to have this procedure because this online person told me that. You don't need to have this procedure. So for me, it's really from a health system perspective, making sure you're putting out valid, cited information and using your experts and leaning into those experts' qualifications, because you can't argue with that. So that's a great way to combat it, but that's a huge, huge problem. Probably just as big as Dr. Google and Dr. ChatGPT.
Thank you for your talk. Do you believe religious beliefs should play a significant role in healthcare marketing?
I think we have to make sure we're letting people know they're welcome at our health system. And that should be by whatever race, religion, what have you, ability. So we need to make sure they know they're welcome. And how we do that, sometimes we can use that in our imagery, in the people we show. We can also mention things or on like social media, celebrate their holidays. We need to make sure that we signal to them that they're welcome at our institution. And so I definitely think religions come in that, as well as race, as well as abilities, as well as different conditions, some of those stigmatized conditions we talked about. If we work on making sure all of that is very inclusive in our marketing, they'll feel welcome and know overtly that we're saying we want to welcome them. So that's important.
Thank you for the talk. This is fascinating. I'm really interested in this idea of how language plays a part in like patient experience and things like that. And I'm thinking in particular about the decades-long framing of like cancer patients as warriors and fighters in battle, in a battle, right? And these claims often, they don't just come from healthcare systems, they come from policymakers, they come from like the NIH, all these different entities. And I'd just be curious about your thoughts on like either this particular example or framing patients as like, fighters or warriors or things like that. Yeah.
That's a great point. I use the example of victim, but this is very similar to that. And when we start to use that kind of language, that they're a warrior or a fighter, and then we have to say they lost their battle or they did something wrong, that's again, it's very stigmatizing to the rest of the world, because it's saying, well, this person didn't fight hard enough. Again, very, very stigmatizing. I think what I prefer is someone use the word journey, that someone's on a cancer journey. They're not a warrior, they're not fighting or battling, because that also implies that they need to try harder to get better. And we all know that's not always the case. But you're absolutely right. That goes for me, that goes in the category of calling people victims. Same with calling people, this person is a warrior. Well, what does that mean, that I'm not trying hard enough because I didn't get better? So that's a great one that we could retire.
Thank you for the insights today. Question for you about whether there is a regulatory oversight opportunity, especially with some of these, you mentioned independent substance use recovery clinics. I think about my own industry, the biopharmaceutical industry, the anti-kickback statute exists, the False Claims Act exists, and yet I was at an event a couple weeks ago and someone said, oh yeah, you know, doctors do get paid for prescribing, right? And they get a cut of that. And I said, no, right? But that perception still persists. And so I'm wondering if, yes, people should be ethical, but if there should be more oversight to ensure that patients are protected who are vulnerable.
Yeah, there is oversight. Like I told you that one example, they were fined $1.9 million and they were barred from deceptive advertising. But honestly, of course, because they got caught, but exactly the same. So FTC does oversee this. You cannot do deceptive or misleading advertising. And there's regulations that it was too much to put into the talk, but around the influencers. They need to, the FTC requires that they call it out that this is a paid advertisement too. So they're trying to enforce that more and more, you see that. But the FTC does have guidance over this, all of kind of advertising and making these claims, because you cannot make false claims in advertising. That's another area that the FTC gets involved with. Beyond that, like the anti-kickback laws, that goes all through all of healthcare, and that definitely was a huge problem in substance use disorder. I can't even tell you, or I could tell you, the horror stories with the kickbacks in substance use disorder, and it's gotten way better, but it was horrifying for a while.
I think
Okay,
that
thanks.
wraps it up. All right, thank you, everybody. We are going to take a 10-minute break, and then we'll be right back here to learn about drug diversion. Thank you.